Hi there, everyone. Hi, good afternoon. Good afternoon. So I am now live here. It's Thursday, October 31st, and I decided to come on for a little bit. I know that I haven't done a video in at least 2 to 3 months. I haven't done a live in several months. So decided to get on today, and hopefully I'll have some of you joining me to really just ask any questions. For those of you that have followed me before, you know that this is really just an informal platform. When I do these Q&As, I try to do them at least once every couple of months or so. I've been a little behind that recently, but they're really designed to have you guys ask me questions in real time. So as you're joining, just know that this is very informal. I'm Camellia Douglas, by the way, if I have any of you who are new subscribers. Um, but I am really just getting on to answer any questions that you guys may have about the PMHNP role or anything related to the mental health field or anything that you want to ask me, really. I do plan to share some updates as well. This will be recorded. So any of you that missed this live will be able to come back to it. But the interesting thing about these lives is that most of you have very similar questions. So I always record them so that you can come back. And if you have a question or you've had a question, usually that gets answered on these lives. I do realize that there was a mishap with the timing of this live. So you guys may not have gotten the notification because I was actually scheduled for yesterday, although I mentioned in the notes that I would be coming on today. So I also realized that some of you may be celebrating Halloween. So um, we may not have many people join us today, but I am really just here to see if you guys have any questions for me. I haven't done this in a long time. So hopefully we'll have some people joining. If you have any questions, we'll make it pretty informal. You can put those in the chat. I'm here to answer any questions you might have about the PMHNP role. I myself have been practicing for upwards of 7 years or so as a PMHNP. I've been in nursing close to 20 years. And I have had a little bit of experience here and there with a lot of different patient populations, also as a PMHNP. I've worked in the ED, I've worked outpatient, I'm now doing telehealth. I also now have my own private practice, which I'm going to share some updates here in just a few minutes. But I do see a couple of you joining. So if you're here and you have any questions for me, while I'm live. Usually I try to stay on about 30 minutes or so. But if you have any questions for me, please put those in the chat and I will answer those questions in real time. Usually these questions are anything you want to ask about the PMHNP role, the journey, your program. Um, and if I can't answer the question, I'll definitely get you the answer. And usually I do a lot of talking with you guys offline. So please share any questions that you may have, those of you that are joining. I am also going to share some updates with my about my private practice. So if we don't have any questions, I will spend some time talking about that. But any questions that you may have, please put those in the chat for me. And again, I realize some of you may be out now, and I also realize that the date was not correct on YouTube. So we may not have as many people today. And that's okay. This will be recorded, so you guys can come back to it if needed. But what questions do you guys have? If you're here, tell me where you're from and maybe where you are on your PMHNP journey, whether you're a student, you're in nursing, you're considering becoming a PMHNP. Tell me where you are and what your plans are. I do see a couple of you here. If you are here, if you'll also give me a thumbs up to make sure you can hear me, that would be great. There's not a real easy way to tell that here. Just to be sure you guys can hear me okay. Okay. Well, as we have more people coming in, hopefully we won't hang around too long if we don't have many people join today. But I do want to share some information about my private practice. I think the very last video I did back in maybe August or so was regarding me deciding to start a private practice as a Psych NP. And I have done so. I had my first patient in August. And I can say that this has been a journey, it's been a process, but it's been well worth it so far, with how things have been going with the private practice. I am now have seen about 60 patients. So we're about 2 months in. I've seen about 60 patients. I am credentialed with insurance companies, the major insurance carriers. And I decided to do that because of the reach to access for patients to have access to mental health care. But also just with some ins and outs of just understanding this world of mental health and kind of how everything works with private practice. I myself have found that most patients do seek to utilize their insurance if they have it. So there are many pros and cons with that, and I'll definitely share my journey about those as they come up. But so far, everything has been good for me by using insurances and having patients be able to use their insurance to provide care. So it's been a really good process so far. I do plan to share more formal information in some format. I haven't decided what that's going to look like yet. I'm also obviously still pretty early into this. But I do want to make sure that I share with you guys some of the things that I'm learning along the way. I will say one of the major things that have come up is making sure that you're prepared pretty early if you decide if you're wanting to do private practice and you're going to take insurance, because that part takes a really, really, really long time. Okay. I still have a few insurances that are pending, and those were started prior to August. So you can see we're well above 3 months in, and some of those have not been finalized. So it does take a while. You also want to make sure you understand the stipulations with each insurance carrier um, as it relates to your supervising physician. If you are in a state where you have to have a collaborator, there's one in particular that actually required that my collaborator um, have the be paneled with the insurance as well. So you want to be prepared for those types of things. But I also say that because this part takes a while, and so when you're really, really up and ready to get going and start seeing patients, it can delay the process. So just keep that in mind. I am working with a billing team, so they are supporting me with filing claims, and also, reimbursement based on the rates that were contracted for each insurance carrier. So I'm learning the ropes on that process, but so far that has all worked out really well. And so I am just, in a process of continuing to learn the ropes here and understand, where I need to delegate. That's a huge piece of this as well, because I am a solo practitioner, but I'm also kind of the administrator for running everything. And so I have to wear a lot of hats most days, and that can become very time consuming. It can become very taxing, to be honest. And so far, um, I'll be honest, I haven't really had a good way of balancing things so far with my private practice, because I'm wearing a lot of hats right now. And I do have some support with, different things that I've already delegated, like my billing, my credentialing. But I'm still wearing a lot of hats so far. And so this has been probably the con in this is that, I'm also still working contracted jobs as well. And so divvying out my time for admin purposes as well as seeing patients in my contracted role and seeing patients in my private practice, it's become really a juggle. But would not trade it for anything. So far, everything is checking out well. And I can say, I think some people have asked me this question over time. Is it something that I regret doing, or, what would I say at this point? I actually don't regret. I don't have many regrets anyway, but I will say that, so far it's been well worth it for me. Also, that includes taking insurance because just balancing out, I don't think you can really buy flexibility, and so that's been a huge plus for me so far. Yeah, very big plus. Um, I'm not really expecting many people to join us today, so I will, give it a few more minutes, and if we have more people to join, so far I have no questions. So I guess we can really just say that this is an update so far for my private practice. But if you guys have questions about anything that I've endured so far and kind of gone through with opening a private practice, starting a private practice. I didn't say this, but my private practice is currently telehealth only. I do have the capability to go into an office. However, right now, most of the patients that I've seen have been by telehealth only. So it's been great. It's been a great process. And I would say for anyone who's thinking about doing it, I would say go for it. Um, it's really been rewarding in many ways, and it's also tapping a little bit more into my creative side, which I haven't really, uh it hasn't come out in a while, but it helps me to tap into some of the things that I have enjoyed doing that's outside of kind of my day to day, and that's just being more creative with things. So I'm enjoying this journey. All in all, I'm enjoying the journey. And like I said, I do plan to have a more formal process for you guys to be able to ask me questions about the private practice process if that's something you're interested in or planning to do. Okay. Yeah. And we don't have many people joining, so I'm just going to give it a couple more minutes. And if no one joins, then we'll end the live, and this will be recorded so you guys can come back to it. Um, I'm trying to think of other things that have come up over these past few months. Um, I know many of you have graduated. So that's awesome. You guys, those that I've connected with outside of the social media platforms, have messaged me. I know at least three of you that have passed the boards recently. So that's awesome. It's great. It's been, I know, a really long road for most of you. It seems like it anyway, although for most of us it's only about 2 years. But finding preceptors and kind of going through all of that, and then finally getting to a point where you get to take your boards and you pass the boards, is an awesome feeling. So congratulations to all of you who have recently passed your boards. Which I know the spring semester ended somewhere around May. So many of you may be planning to take it soon, or you may have taken the boards already. So, congratulations to those of you that have passed the boards. And thank you guys, that those of you that have shared the good news that you've passed. So, congratulations. Yeah. So I have a couple people joining here. This is very informal. I've just basically been talking about updates and kind of how things are going with my private practice. But please plan to share who you are or where you're from, maybe, and any questions that you might have. And I'll just give it for probably another 2 minutes before we end the live. Yeah. And I've had a lot of questions also about, which program do I choose? How do I know which program to choose? I've done a video on that as well. But you really want to do your due diligence on the programs, because I will say, I mean, I graduated in 2017, and there are probably triple the number of programs for PMHNPs than that there were back in 2017. So some of the programs I'm not familiar with. A few of them I am, because I have colleagues that have gone there as well. But when you're choosing a program, just generally you want to make sure that obviously the accreditation is there, but also, just understanding how credible is it, is the program. Are you, really guided with your academics and your, you know, coursework? Um, do they help you find preceptors? Do they require that you have a certain level of experience? Those are just kind of some general questions that I would think about if I were going into applying for a program at this point. Knowing what I know now, those are the things that I um, would be asking. You also want to know what their pass rate is if they're not a new program. What is their pass rate for the boards? Um, how do they prepare students for their certification? And it's always a good idea to talk to students who have gone the road before you as well. So that's something you can do. Joining a Facebook group for the college, or some type of community where you have access to those students, is usually a good way to go. Just to kind of know what they've experienced, what are the pain points, and really if it's a good program. So that's just one question that I've gotten a lot of lately. We have a lot of people going back to school now, and many of you have asked me questions about, how do I decide? So just really, doing your work, your homework around the programs I would suggest, and not just, and also look at the acceptance, rate of the program. If they're accepting everyone who applies, that may tell you that the academic rigor for that program is not there. So you just want to make sure that you're, you know, going to a program that they're going to set you up for the best, set you up for success, and they're going to set you up to actually pass your boards, but also to be able to practice like you need to be practicing. There are a lot of programs that also don't oversee their clinical practice requirements. And so, a lot of students now have to pay for their practicums. And so we don't know always what you're going to get with those particular programs. So, and also with, when you're hands on and you're learning in the practicums, you really want that to be supervised, or you want to know that there's a certain standard there, so that when you start practicing, you're able to, really do what is necessary, and kind of learn your way of doing it, but also, just understand what the expectations are of the role, and, how to interact with patients, how to make decisions around treatment planning, how to critically think about diagnoses. Those are all things that you want to make sure that you know how to do, because essentially you're going to be flying on your own. Although if you're with a collaborator, you'll have that level of support. But I know many students who have gone into new jobs without having as much support as they thought they would have from a collaborator, for whatever reason, whether it's the collaborator's time or not being familiar with, nurse practitioners and kind of what we do. There's so many different variations there, and so you want to be prepared for yourself, so that, not that you won't require some level of support starting out. I mean, I will tell you that I still lean on my supervising physician for cases, for things that I've not seen as much of, or if I have a treatment resistant case, I'm going to go back to my supervising physician to, collaborate about, what would you do here. But you want to have a good basis for yourself to know when and where to also ask for help. Sometimes you're not going to know that as a new provider, but you definitely want to have a good foundation, so that, you're able to feel confident in what you're doing, and you're able to grow in this. So, um, I'm sort of rambling at this point, but these are some things that have come up from people that have asked questions outside of YouTube and even on here. I really appreciate you guys following me. I will continue to provide, insight and updates as they come. But since we don't have many people joining now and no one's on at the moment, I am gonna go ahead and hop off. But certainly, if you have questions or anything that you want me to answer or do a video about, please comment below this video and let me know. And I'm happy to explore it. There may be a video already out about some of these things because again, a lot of you have the same questions. But please let me know if there's anything you want to know more about. And like I said, I will have another formal platform for answering questions about private practice. So hopefully this was helpful for you guys. I will plan to do another live in the next 1 to 2 months. Hopefully next month I'll be able to pop back on and we may have more people to join us. But it's also Halloween, so some of you may be already going out at this point as well. So I have one person who joined again. So if you have any questions for me, I'm going to stay on for another few seconds. Please let me know if you have any questions. It looks like they popped off as well, so it's fine. We'll certainly plan to pick up at some point later. But you guys let me know if you have any other questions, and have a good evening. Thanks.